So you're dealing with low back pain. This can be incredibly frustrating because there are so many different causes when it comes to hurting your low back. But today we're going to discuss one of the most common injuries we see in the office, which is your typical lumbar sprain strain. This could be an injury to the joints or to the muscles, and it is the common injury we see when someone throws their back out. Many times you're picking up something heavy or bending over to pick something, and you just feel that back tighten up, spasm. It can send you to the floor. And what we're discussing today is the low back pain that stays in the low back. We're not talking about pain that refers down the leg or lightning or numbness or any of that. This is going to stay right along that pattern in the low back. Now, the most common thing we're going to do for this injury is the chiropractic adjustment. Whether it is a full-on adjustment or it is a mobilization, getting those joints moving better can immediately make the pain reduce. It can increase your range of motion. And a lot of times it's going to cause those muscles around the area to relax. But we do still want to come back and address those muscles afterwards. There are two big muscles that run all the way up and down the spine called the erector spinae. And these guys, a lot of times when we have this injury, they will tighten up and spasm and hold on for dear life to try to protect you when you have that injury. Or they could be the thing that's injured in the first place. The muscle sometimes takes the injury and sometimes it's the joint. So we're going to go through and address those with any of our soft tissue therapies, from using our hands, tools, needles, laser. All of those can be included in that, as well as the muscles that are deep to those, the quadratus lumborum or the QL, which are just underneath those erector spinae. And these two together can cause all kinds of pain and injury and spasm in the low back. So we're going to go through and calm those guys down. Now, we want to make sure that all of this increased range of motion and decreased pain sticks around for a while. For an injury like this, you should not have to be seeing me over and over again for the rest of your life just to get back to living a normal life. And so we're going to give you some exercises to make sure all of this stuff that we did that makes it feel better sticks. So let's go ahead and take a look at a couple of those. Now we're going to start with a foam roller. Love them or hate them, foam rollers will generally help calm the pain down pretty quickly. And this may not be the fix long term, but this is something you can do on your own that many times will calm down that tight muscle that we're feeling and really start to help with some of the pain as we're working this out. So what we'll do for the low back is you're going to go ahead and lay on the foam roller here. We have two options with this. We can let ourselves fall into extension, and a lot of times you're going to be working more around the joint with this. You may get some bonus pops, but that can be a little too aggressive in the beginning. And so what I want you to do is you're going to give yourself a hug and try to stay up in a little bit of flexion. And we're just going to roll back and forth like this. Now, as we do this should feel nice. You should feel like you're starting to get those muscles to calm down a bit. But we don't have to hang out here for 30 minutes. This is something where you're going to roll back and forth 5 or 6 times. You can roll a little bit more over to one side. Roll over to the other side. And really, we just want to get those muscles to release a little bit, to relax. And you're going to get some extra blood flow to the area too, which generally is going to be helpful. Now that we've reduced some of the tension and tightness, we have to get those joints moving again. And generally, flexion and extension are going to be the ranges that are scary for most people. So we're going to add in something called seated tide. With this, you want to go and try and find your end range as we do it, but I do not want you to crank into pain with this. We're going to start seated, and the first thing we're going to do is work on that lower back and pelvis, kind of trying to differentiate which is moving at what time. And you want to think of your pelvis like a bowl of water. We're going to pour some out in the front, pour some out in the back as we work our chest forward and work our chest back like this. If you get to here and this is painful, just don't go quite so far, but we want to go right to the edge of that, come out, back and forth for a few reps. Usually we're going to do about 5 reps per position. After that one, we're going to move it up to the mid back. Same thing, chest forward, chest back, but you're going to keep your head in the same position. So we're going to be pushing that chest forward and then driving back through that mid back as well. Same thing, you're going to do 5 reps here. And after you do your reps there, we're going to work that upper back. So we want to get the whole spine moving. With this, we're going to go hands up and over, take your chest towards the ceiling, and you're going to reverse and take your chest towards the floor. Same thing with this, we're not cranking into pain, we're just opening up all these joints, and you may get some bonus pops in the back and in the shoulders. As long as they're not painful, that's okay. But we're going to go through 1 to 3 rounds of that, 5 per position, really making sure we're opening up those joints because we need those ranges for life. And these are a couple of the generic exercises we'll do for low back pain. These are going to help most of our patients, but really, you need that full exam to make sure we tailor this treatment to you. These can be helpful for most people, but your body is different than everybody else's body, and your injury is specific to you. So go ahead and give us a call to get on the schedule today to make sure that we can tailor a plan specifically for you and get you back to living the life that you deserve.